Hello and welcome to Joy in Our Town. I'm Sherry Duckworth, and joining me today is Ms. Katherine Krause, President and CEO for VNA. Thank you for being here today.
Good morning. Thank you for inviting us.
Yes. Now, you do a wonderful service for our community, and you care for our aged loved ones, our aging loved ones. And there's always a lot of questions and concerns when it comes to our aging population and those that are the caregivers. So we're glad you're here to
Thank you.
help us out today.
Well, glad to talk about VNA.
Yeah. So talk to us first about what does VNA do?
What VNA does, and we have been around for 81 years, but today our mission has evolved into helping people age with dignity, and particularly in their homes. And that's through 3 services, and that's Meals on Wheels, hospice, and private home care.
Great. Okay, so the need for VNA, obviously the private home care, you mentioned allowing seniors to stay home longer, which is really a big desire for many of our aging population. They want to keep their independence. Talk to us about what the need is in numbers.
Numbers. Well, let's go through each thing that we do, and let's start with the hunger issue with seniors. And we are, out of all the states in the United States, we are the 5th highest in terms of hunger in seniors. So there are people in our community going to bed hungry every night that are of senior age. Right now, Meals on Wheels, VNA Meals on Wheels takes care and delivers to 4,700 homebound seniors in Dallas County specifically, and we have a 2,800 waiting list.
Oh my goodness.
Yeah, so it's huge. It's huge.
I think it's very upsetting knowing we live in such an affluent part of North Texas. For us to have that number, that high of a number of elderly who are hungry is very upsetting. Can you talk to us a little bit about why that is?
Well, okay, let's talk about the positive first.
Okay.
The positive, why it is, we have 10,000 people turning 65 every day, so our population continues to grow in terms of our older population. But the good thing about it is that we have hundreds of people that donate their time and money to VNA.
That's great.
And so you have volunteers going out every day to not only deliver a hot, nutritious meal, but also deliver social nutrition. So it's not just the meal that's important, but it's the social isolation that those volunteers connect with another human being.
Right.
And
Yes.
our oldest client was 107 years old. That what she said is that VNA Meals on Wheels never forgets about me. All the volunteers take care of me. So,
That's
I mean,
wonderful.
that's the blessing. That's the
Yes.
great blessing. Now, the flip side is that hunger and poverty have always been with us since the beginning of time. And so it is just on a daily basis, everyone should remember that there are others in the community that are in higher need than ourselves, and that whatever we can do to help those people. Do you know of your neighbor? Are they hungry? Are you, stop and make sure that person, you know what your neighbors are doing.
I like that. I think
Yeah.
it's good for us to be vigilant and for you to, talk to the community today about remembering your neighbor. Go knock on their door. Notice if they're not outside. Notice if things seem different, if they're not getting around as well as they used to. Ask them, how they're doing.
Right.
So
It's taking care of each other.
it really is taking care of each other, and I think we get away from that. We get so busy today in our world, so that's a great reminder.
It's a humbling experience to deliver Meals on Wheels. So if you haven't delivered Meals on Wheels, I highly encourage you to do that.
Yeah, well, we thank all the volunteers that do that for you, and what a great way to give to the community. And it's great to hear, like you said, it's about the isolation really more than probably the meal. They get that one-on-one time with another person.
It's as important, let's put it that way.
Yes.
And when we're also their safety net. When we have many stories, we'll find that they're in a crisis, and or perhaps have fallen and can't get up. I know that sounds like a cliche, but it actually happens.
But it does happen.
And without that Meals on Wheels person stopping by to check on them, it sometimes might not be as good of ending.
Yeah, for sure. Now, talk to us about the hospice care. What's the number there?
The hospice, what hospice is, let me explain what hospice is first.
Yes.
And hospice is within the last, you have to have a diagnosis of 6 months or less to live.
Right.
And you also have to have decided that you are not going to get curative treatment anymore. So a hospice team, which is a chaplain is a physician, a nurse, an aide, they surround you and your family with support and guidance and love about helping get your life in a situation where you are living the best you can for the last 6 months, and then we work with the families and we provide pain control, and we provide a high quality of life for the last 6 months of life.
Because there's so many details that we don't think about. Most of us who are losing someone are just thinking about the fact that they're not going to be with us, but there's a lot that goes into that in-between time, especially when you know you have time to prepare.
And it helps the families understand what the stages are as well.
Right, and it's good to be educated. It's good to know what to expect, what's normal, what's not.
Right.
You know, what you can try and mentally and emotionally prepare for.
It's never easy.
Right.
It's never easy, and I don't mean to speak about it lightly. We have 250 clients that we have on service, and it is never easy, but it can be a beautiful experience.
And that's good to hear, especially for those watching today who maybe their loved ones are in this, phase of life where they're thinking about, what's going to happen next. So it's good to know that there's somewhere they can go and get advice and find out what to do.
And VNA has been in existence since 1934. Hospice is a benefit for Medicare, which is paid for under Medicare, has been in existence since the early 80s, of which we've been providing care since then. So we are the oldest hospice agency in the Metroplex, and we serve 13 counties.
Talking about having things covered by Medicare, that's always obviously very helpful, especially when you're caring for aging parents. Can you talk to us about some of the challenges that caregivers are facing and the advice that you give them from VNA to help in the situation of caring for your elderly parents?
Okay, that's the most important question that we've talked about yet this morning. Number one, as a caregiver, whether it's your spouse or whether you are the child of an aging parent, number one, you have help in the community. If you're not at the hospice level, then that's fine, but whether you need caregiver support, friend support, take care of yourself first and foremost. Caregiving is a very consuming thing, and if you don't take care of yourself, you will not be able to take care of that other person. So highly encourage, whatever stage you're at, is to make sure that you're taking care of yourself. I can use my father-in-law as an example. My mother-in-law has Alzheimer's, and it's a long, slow process of decline, and he insists on doing everything himself. It's hard to even get help to him. So I talk from personal experience, and his health is now declining. Please take care of yourself. Let people take care of you. It is hard for the greatest generation to accept help. Many of our Meals on Wheels folks, it's always somebody else calling us to get help, because they are from a generation where they are not going to ask for help. And so it's usually people calling us saying, please, would you convince my parents that they need help, or back to the caregiver. Please take care of yourself first.
Yes. No, I'm very passionate about it too. Our family's in a similar situation, and so I understand your passion concerning that. You want the caregiver to make sure they're taken care of so that they can continue taking care of their loved one.
Right.
So
and call VNA. We're happy to advise on whatever level. We're also a good resource from a community standpoint. We have nurses on staff, intake people, to just kind of answer your questions about what might be good in a certain stage of life. We are a resource to the community. We're a nonprofit, and that's why we're here to help people age with dignity and independence, and hopefully in their homes.
Yes, and I think you hit on a few things too that just kind of, I guess, just light up in my mind. You know, the staying home. You had mentioned Medicare services before, and helping the people who are taking care of your loved one staying at home as well. I mean, those needs, and specifically, especially long term, to make sure that all of those things are lined up, and This is the cost of being taken care of at home. This
Right.
is the cost if you are going to go to long-term care. This is what
Right.
Medicare will cover. This is what they won't. All of that can get very overwhelming
Right.
and confusing. So if we call you,
Yes, yes.
if we call you, will someone be able to walk us through our options?
Call me. Call
Okay.
me, and I'll get you in touch with the right person, whether it's on staff or whether it's within the community. Call me.
Yes.
Call me personally, and I can direct you in the
help.
right direction. Yes.
And then if people want more information, they can visit the website as well, which
Yes.
is VNA Texas.
Lots of resources there, lots of links to places you can go.
Okay.
But I think another piece of advice when you have an elderly parent, and I say elderly, stuff can happen any time, but
It's true.
make sure you're having the conversations. They're difficult to have, but what are your parents' goals?
Right.
Do they have an advance directive?
That's important.
Do you have a will?
Yes.
Because we
An up-to-date will.
An up-to-date
An up-to-date will.
I can't even suggest that mine's up to date, but make sure you have a will, especially in the state of Texas. It's very important. Otherwise, your relatives and your beneficiaries will have a very difficult time when you're. Please get a will. Have advance directives, but also have a discussion with your older parents to find out what their goals are, what their goals for quality of life. Where do you want to be in your last year of life? Have those conversations, and it's not going to happen in a day, so just start broaching the subject.
It's true. I had somebody once tell me that we're still the same person when we're, elderly that we were, when we're young.
Yes.
So the person that you are now, it's okay for you to make decisions and plan for it and talk with your family while you can still think clearly.
Yes.
For yourself, because unfortunately, sometimes part of aging, it affects our mind and dementia happens,
Right.
so forth, et cetera. So, having that written down and in,
Correct.
In ink, and everyone knows what to expect.
Correct. And what our wishes are, both
Yes.
medically and personally.
And we're respecting your wishes, respecting the person that we love and how they want to be cared for.
Right.
So that's so important.
Don't wait till it's too late before you ask those questions.
So true. What would be some more, that is a great warning for us. What's something else you would want us to know in the community when it comes to elderly care that maybe we forget to think about?
Here's a thing that people don't think about. Long-term care, Medicare does not pay for most long-term care services. They pay for hospice, they pay for hospitalization, but if you're aging in your home, most long-term care services, unless you have a long-term care policy, that is not covered. So when you want help in the home to cook, help you with meals, which is hard to do sometimes, or when you want a health aide to come in 4 hours a day, a couple days a week, we also do that, by the way. But if you want help and support in the home to help you age in the home because you can't mow your lawn anymore, you can't use the stove anymore, you need a little extra help, that is not paid for by Medicare. So again, back to preparing, help find out how much those kind of services are going to cost you long term and to be prepared for that. Long-term care is not paid for by Medicare unless you're in need of hospice or being in the hospital.
Right. No, that's very good for people to know so they can prepare and plan.
Yes.
Thank you so much for being here
Thank
today,
you.
Ms. Krause. I appreciate it.
I hope it's
You've given us a
helpful.
lot of
Thank you.
information and things to think about and planning ahead, so thank you.
Thank you.
And we'd like to thank you all today for watching us here at Joy in Our Town.
Water